Let me tell you about a patient. I'll call her Margaret. She was 68 years old, sharp as a tack, did the crossword every morning, remembered every birthday in her family without checking a calendar. Her daughter described her as the human Google of our household. Then, about 18 months after her doctor added a new prescription to her daily routine, her daughter called me in tears. Margaret couldn't remember what she'd eaten for breakfast. She was getting confused driving home from the grocery store she'd visited every week for 20 years. She repeated the same questions 3 times in a single conversation. Her neurologist suspected early Alzheimer's. Her family was devastated. But here's the thing nobody told them, and this is what I need you to hear right now. Margaret's dementia wasn't Alzheimer's at all. It was her medicine cabinet. When we systematically reviewed her medications and made strategic changes with her physician's guidance, Margaret started coming back. Within 4 months, she was doing the crossword again. This is not a miracle story. This is preventable medicine. And today, I'm going to walk you through the 9 most common medications that could be quietly, invisibly stealing your memory, ranked from commonly overlooked all the way to the most dangerous combination most doctors never warn you about. I'm Dr. Franklin, and this video could be one of the most important 20 minutes you spend this year. One quick thing before we dive in, stay with me all the way to number 1, because number 1 isn't a single medication at all. It's a hidden pattern that affects millions of seniors right now, and almost nobody is talking about it. Let's get into it. Now, I want to be clear about something before we go through this list. I am not telling you to stop your medications. Please do not do that without speaking to your physician. What I am telling you is that you have every right to ask questions, to understand what's going into your body, and to advocate for the health of your brain. Knowledge is not dangerous. Silence is. Also, drop a comment below right now. Tell me, are you over 60? What medications are you currently taking? I personally read through comments, and I want to understand what you're dealing with. Your experience might help someone else watching this today. All right, number 9. Medication number 9, diphenhydramine. Here's a question. How many of you have a small bottle of Benadryl in your nightstand right now? I'm guessing it's a lot of you, and I completely understand why. It's cheap. It's over the counter. It says sleep aid right there on the package. What could be more harmless? Here's what that little pink pill is actually doing inside a brain over 60. Diphenhydramine belongs to a drug class called anticholinergics, and that word is going to come up a lot in this video, so remember it. Anticholinergics work by blocking a neurotransmitter called acetylcholine, which is the brain's primary messenger for forming memories, maintaining focus, and staying alert. When you're young, your brain has plenty of acetylcholine to spare. When you're over 60, you're already running on a lower baseline. Block even more of it with a nightly Benadryl, and the impact is significant. A landmark study in the Journal of the American Geriatric Society found that older adults using diphenhydramine regularly faced a substantially elevated risk of cognitive decline, with measurable shrinkage in memory-related brain regions identified in neuroimaging studies. The sneaky part? It hides in dozens of products you don't even think of as antihistamines. Anything labeled PM, nighttime relief, or sleep formula almost certainly contains diphenhydramine. What to do instead? For allergies, ask your doctor about second-generation antihistamines like loratadine, Claritin, or cetirizine, Zyrtec. These don't cross the blood-brain barrier the same way. For sleep, we'll talk about safer alternatives later in this video. Medication number 8, proton pump inhibitors, PPIs. Raise your hand if you've been told you need to take an acid reflux pill every single morning, and you've been doing it for years without anyone ever suggesting you try to stop. This is one of the most overprescribed medication categories in the entire world. And the problem isn't just that people are on them, it's that they're on them indefinitely, when most were designed for 8 to 12 weeks of use. Proton pump inhibitors, or PPIs, reduce stomach acid. That sounds straightforward. The problem is that your stomach acid also serves a critical function. It extracts and absorbs vitamin B12 from your food. B12 is not optional for brain health. It's essential. Deficiency in B12 is clinically linked to memory impairment, depression, nerve damage, and a pattern of cognitive decline that mirrors early Alzheimer's so closely that the two are sometimes confused even by experienced physicians. A 2016 study in JAMA Neurology examined over 73,000 adults, 75 and older, and found that long-term PPI users had a 44% higher risk of developing dementia compared to non-users. But it gets more layered than that. Research has also shown that PPIs may accelerate the accumulation of amyloid beta plaques, the toxic protein buildup that's one of the defining features of Alzheimer's disease. We're not just talking about a B12 deficiency, we're potentially talking about a direct molecular pathway to neurodegeneration. What to do? Talk to your doctor about tapering off PPIs using H2 blockers like famotidine, Pepcid as a bridge. Dietary changes, smaller meals, avoiding late-night eating, elevating the head of your bed slightly, can dramatically reduce reflux symptoms naturally. And if you stay on PPIs long-term for genuine medical need, make sure your B12 and magnesium levels are tested regularly. If you're still here with me and finding this helpful, take a moment to type 8 in the comments. It lets me know you're watching and getting value from this. Medication number 7, bladder control medications. This one genuinely frustrates me, not because of the medication itself, but because of how little patients are told about it. Overactive bladder is a real issue. It's embarrassing, it disrupts sleep, it affects quality of life. And when a doctor hands you a prescription for oxybutynin and tells you it'll help, you take it. Of course you do. What almost nobody explains is this. Oxybutynin is one of the strongest anticholinergic medications in common clinical use. It doesn't just work on your bladder. It crosses the blood-brain barrier with remarkable ease and directly interferes with the same acetylcholine systems responsible for your memory and learning. Studies have shown that the hippocampus, the brain's memory filing center, actually demonstrates measurable volume reduction in long-term anticholinergic users. We're talking about a physical structural change, not just foggy thinking. Brain tissue. A comprehensive 2019 study published in the British Medical Journal found that seniors who use strong anticholinergic medications like oxybutynin for more than 1 year had a 49% higher risk of dementia diagnosis, nearly 1 in 2. Here's what makes this particularly heartbreaking. The early cognitive symptoms, forgetting appointments, misplacing objects, losing words mid-sentence, are almost universally chalked up to just getting older. The medication never gets questioned. The good news, newer bladder medications like mirabegron, mirbatrix, work through an entirely different mechanism, beta-3 adrenergic agonism, and carry dramatically less cognitive risk. If you're on oxybutynin and you've noticed mental changes, please have this specific conversation with your urologist or primary care physician. Medication number 6, benzodiazepines. I want to pause here for a moment because this next category is one that people have very strong feelings about, and understandably so. Benzodiazepines, or benzo, have helped millions of people manage severe anxiety, panic attacks, and sleep disorders. For many people, they felt like a lifeline at a desperately difficult time. I am not dismissing that. What I am asking you to do is hear the science. Benzos work by amplifying a brain chemical called GABA, your natural calm down signal. They're remarkably effective at producing short-term relief. The problem is what happens when that mechanism stays switched on for months or years. A 2022 study tracking over 8,000 seniors across a 6-year period found that those who used benzodiazepines for more than 3 months had a 51% increased risk of Alzheimer's disease. The risk was highest for long-acting formulations like diazepam, which accumulate in fatty tissues, including brain tissue, over time. Here's the biological explanation. When GABA is chronically over-amplified, your brain starts reducing its own natural activity and response. Neuroplasticity, the brain's ability to form new connections, learn, and adapt, begins to deteriorate. Memory encoding slows, emotional regulation falters. The brain that was being calmed begins to lose its capacity for dynamic response. And the trap? When you try to stop, withdrawal is brutal. Rebound anxiety and insomnia can be far worse than the original symptoms. This makes the drug feel necessary, even as it's causing the problem. Important, never stop benzodiazepines abruptly. This can be medically dangerous. Work with a physician on a slow, supervised taper over weeks or months. Alternatives include buspirone for anxiety, CBTI, cognitive behavioral therapy for insomnia, for sleep, and in some cases, low-dose melatonin or magnesium glycinate. Medication number 5, statins. Now, before I explain this one, I want to be careful because statins genuinely save lives. Cardiovascular disease remains the number one killer of people over 60, and for many patients, statins are appropriate and important. But here's what your cardiologist may not have told you. Your brain is made up of nearly 60% fat. Cholesterol is not the villain it's been portrayed as in the context of the brain. It's a structural necessity. It forms the myelin sheath, the insulating layer around your nerve fibers that allows signals to travel quickly and efficiently. It's involved in the formation of synapses. Without adequate cholesterol, your neurons struggle to communicate.